Honored to speak today on a topic increasingly gaining global attention. Integrative oncology and the role of homeopathy in cancer care. Cancer remains one of the leading causes of morbidity and mortality worldwide. Despite significant advancement in conventional oncology, including surgery, chemotherapy, radiotherapy, triggered therapy, and therapy, to suffer from physical side effects, psychological distress, reduce quality of life. This is where integrating oncology emerges as a patient-centered, holistic global concern. Cancer burden. Cancer remains one of the leading causes of morbidity and mortality worldwide. According to the global estimates, millions of new cases are diagnosed each year, and the burden is steadily increasing, especially low and middle income countries like Bangladesh, Nepal, India. In the countries, Bangladesh, late diagnosis, limited resources, and inadequate support for the outcomes. Challenges in the cancer treatment. Conventional cancer treatments such as chemotherapy, radiotherapy, and surgery is essential and life-saving. However, they often come with significant challenges, including physical side effects like nausea, fatigue, hair fall, pain, feverish, skin change, psychological stress like anxiety, depression, post-traumatic stress disorder, reduce quality of life. These highlight approach in cancer care. What is integrative oncology? Integrative oncology, the evidence-informed use of complementary therapies alongside conventional cancer treatments to improve patient outcomes, quality of life, and overall well-being. It combines conventional medicine, complementary therapies such as nutrition, mind-body medicine, acupuncture, and homeopathy. The goal is not to replace conventional treatment, but to support and enhance it. The core principles of integrative oncology includes patient-centered care, evidence-informed participant practice, a multidisciplinary approach involving oncologists, nurses, complementary medicine practitioners. This approach ensures that care is both safe and holistic. The main goal of integrative oncology to improve quality of life, reduce treatment related side effects, to support mental and emotional well-being. So ultimately, it aims to the overall patient experience during cancer treatment. Now, our complementary therapies. What are the complementary therapies? A variety of complementary therapies are used in integrative oncology. These includes nutritional support, mind-body therapies such as meditation, acupuncture, yoga, and homeopathy. Each of these plays a supportive role when used appropriately. Now I share about introduction of homeopathy. Homeopathy is a system of medicine developed by Dr. Samuel Hahnemann in the late 18th century. It is based on the principles of like cures like and emphasize individualized treatment rather than focusing only on disease. Homeopathy considers the patient as well as a whole, not only patient, body, mind, and environment, other than causes and homeopathic physicians. Key concepts of homeopathy. Some key concepts of homeopathy include a holistic approach to patient care, individualization of treatment, minimal dose. This principle distinguished it from conventional pharmacological approaches. Now I share about role in oncology. In oncology, homeopathy is primarily used as supportive therapy. Its potential roles include symptoms relief, very soon improving patient comfort, enhance overall well. It is important to emphasize that it is not a replacement for conventional cancer treatment. How we manage symptoms? We manage symptom homeopathy may help in managing common symptoms associated with cancer and its treatment such as pain, fatigue, nausea and vomiting, anxiety and depression, oral mucositis. Managing those symptoms can significantly improve patient quality of life. Why integrative approach is needed? Cancer is not just a physical disease. It affects mind, emotions, social relationship, spiritual well-being. Patients often experience anxiety and depression, fatigue, pain, nausea, vomiting, sleep disturbance, hair falling, and an integrative approach address the whole person, not just the tumor, not just the partial, not just total. All of the symptoms are important in homeopathic approach. Commonly used homeopathic remedies in cancer, some frequently used remedies based on symptom similarity. This is our main activity of homeopathy for role. Arsenic album, carcinosin, phosphorus, conium maculatum, cadmium salt, like that. Arsenic album, anxiety, restlessness, beginning, burning pains, carcinosin, family history of cancer, perfectionism, phosphorus, weakness, bleeding tendency, emotional sensitivity, conium maculatum, heart tumor, glandular indurations, cadmium salt, severe nausea after chemotherapy. Remedies must always be individualized. So we are now share evidence and research. When we look at the scientific evidence, the findings are mixed. Some clinical site studies and observational reports suggest that improvements in symptoms control and quality of life. However, other studies show limited or inconclusive result. Therefore, more rigorous, large-scale clinical trials are needed to establish clear evidence. Safety and ethical consideration. It is crucial to emphasize safety is a critical issue. Homeopathy should not replace conventional cancer treatment. It should be used as a complementary therapy. Collaboration between oncologists and homeopaths is essential. Safety advantages include minimal side effect, non-toxic natures, compatibility with conventional treatments. It should never replace participate practiced by qualified professionals. Patient must be properly informed. Ethical practices is essential in integrative oncology. Clinical integration, in practice, integrative oncology requires a multidisciplinary approach, such as oncologist, nurse, complementary medicine practitioner. So, such collaboration ensures coordinated, coordinated and patient-centered care. Future directions to advance integrative oncology, we need event evidence-based research, interdisciplinary collaboration, patient-centered care models, education and training programs. Education is the must and training must for integration and homeopathy research. The future of cancer care lies in integration, not oppositions. However, this example should be interpreted cautiously and not considered definitive proof of efficacy. Public health perspective in Bangladesh, from a public health perspective, integrative oncology has important implications in Bangladesh. Challenges are high cancer burden, limited access to supportive care, and financial constraints. Homeopathy being widely available and relatively low cost may play a supportive role if properly regulated and integrated. What are the challenges to treatment integration on homeopathy? Despite its potential, several challenges remain. Lack of strong scientific evidence, regulatory gaps, risks of misuse by unqualified practitioners, misinformations among patients. This challenge must be addressed carefully. But there are many opportunities in this research. At the same time, there are significant opportunities, development of research in integrative oncology, establishment of integrative clinics, policy support and guidelines. This can help ensure safe and effective use of complementary therapies. Now, I recommendation. There are many recommendations in research, many other research studies based on current understanding. The following steps are recommended: conduct high quality clinical trials, strength, education, and training, develop regulatory framework, promote collaboration between different healthcare systems. These steps are essential for progress. In conclusion, integrative oncology represents a holistic patient-centered approach to cancer care. Homeopathy may Homeopathy, when used responsibly and scientifically, can use to improve quality of life, support healing. Let us say healthcare system where we treat not just the disease, but the person who is suffering. Homeopathy may offer supportive benefits, symptom management, and quality of life. However, it is used must be evidence, ethical, and well regulated. Further research is essential to clarify role in modern Oncology. Thank you for our kind attention. I hope this discussion contributes to a broader understanding of how we can work together to provide more human and holistic cancer care.